I'm Dr. Steve Knighton from Nottinghill Family Wellness Centre, and today we're going to go over the treatment we do for bunions and basic toe and foot pain. So as you see here, this patient has a bunion on her right foot. We start most bunion treatments with the Suction IFC, it's an electric stim, with a heat pack just to get a ton of blood flow to the area. We could move the pad up into here or more on the bunion or more down here, just depending on the patient's foot. This is on for about 8 to 12 minutes to get a ton of blood flow. With the heat pack, we find it really warms up the area and the joint. After that, we go into a thing called Shockwave. Shockwave is a pneumatic gun. There's a bullet in the tube here that hits the applicator head, and we run the area of pain in the bunion. Will come around the joint and the soft tissue. We change our heads up for the bunion and usually use the red head. For the Shockwave application, we do put some ultrasound gel on the patient's foot and then run the Shockwave in and around the foot like this. It is relatively painful. Hits for the Shockwave will go up to as high as 1500 on the foot. We'll run along the bunion, into the toe. We'll even work sometimes on the bottom side of the foot depending on the patient, and then go from there. We work with patients' pain tolerances for the Shockwave and go from there. After that, we'll go into something called instrument-assisted soft tissue. We use a tool like this to get in the joints and in the tissue of the foot, and we come in and scrape like this. It's going to be one of the most painful things we do at the clinic, but patients see great results. Now, with most bunion cases, we're not going to be able to pull the toe over. It's more of a pain prevention and to overall get the overall biomechanics of the foot. So, bunion treatment, we start at the IFC with some heat, into the Shockwave, into some instrument-assisted soft tissue.